Welcome to Women Health and Infertility. I am Dr. Aniku, a gynecologist, and today we are discussing an important but often misunderstood topic: vaginal ulcers and vaginal lesions. Many women become worried when they notice a sore, ulcer, lump, growth, or unusual lesion around the vaginal area. Some lesions may be harmless, while others may indicate infections, autoimmune diseases, precancerous conditions, or even cancer. Understanding the causes and knowing when to seek medical attention can help ensure early diagnosis and appropriate treatment. In this video, we will discuss what vaginal ulcers and lesions are, common causes, investigations, treatment options, and when to see a gynecologist. Stay until the end because I will share some warning signs that should never be ignored. Let us begin with definitions. A vaginal ulcer is an area where the skin or lining of the vagina or vulva breaks down, creating a sore or open wound. A vaginal lesion is a broader term that refers to any abnormal change in the tissue. Lesions may appear as ulcers, bumps, lumps, or growths. Women may experience pain, burning, itching, bleeding, vaginal discharge, or pain during urination and intercourse. Some lesions may cause no symptoms and are discovered during routine gynecological examinations. There are several possible causes. Let us discuss the most important ones. One of the most common causes of painful genital ulcers is genital herpes, caused by the herpes simplex virus, or HSV. Symptoms may include painful blisters, multiple small ulcers, burning sensation, fever, or swollen groin lymph nodes. The first infection is usually more severe than recurrent episodes. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. In the early stage, it typically presents as a single painless ulcer with firm edges and minimal discomfort. Because it is painless, many women may not notice it. Early diagnosis is important to prevent serious complications. Chancroid is another sexually transmitted infection. It usually causes painful ulcers with soft, irregular edges. Although less common today, it remains an important consideration in some regions. Certain HPV strains cause genital warts, appearing as small growths or cauliflower-like lesions. Other HPV types are associated with cervical, vaginal, and vulval cancers. Severe infections may occasionally lead to tissue irritation and lesions, such as candidiasis or chronic bacterial infections. These often occur in women with weakened immune systems. Behçet's disease is an autoimmune condition that causes recurrent painful genital and mouth ulcers. Women may develop eye inflammation and skin lesions. The ulcers may recur repeatedly over time. Lichen sclerosus is a chronic inflammatory skin condition causing intense itching, white patches, and fragile skin. If left untreated, it may increase the risk of vulval cancer. Lichen planus is another inflammatory condition causing painful erosions, ulcers, and vaginal scarring. Physical trauma can cause vaginal lesions, including sexual injury, childbirth-related injury, or accidental trauma. Rarely, certain medications like antibiotics or chemotherapy can trigger ulcer formation. Although less common, cancer must always be considered, especially if a lesion does not heal within a few weeks. Warning signs include a persistent ulcer, non-healing lesion, bleeding, abnormal growth, or weight loss. Many women ask, "Doctor, what tests will I need?" The answer depends on the suspected cause. Your gynecologist will ask about symptoms, duration, sexual history, and medication use to guide the diagnosis. A thorough examination assesses the location, size, and appearance of the lesion for diagnostic clues. Samples may be taken to test for herpes, bacterial infections, or other sexually transmitted infections. Blood investigations may include syphilis screening, HIV testing, and checks for autoimmune diseases. Depending on risk factors, screening may be recommended to evaluate for HPV-related disease. A biopsy is one of the most important investigations for persistent lesions. examining a tissue sample under a microscope. Treatment depends entirely on the cause. Let's look at the options. For ST is like herpes or syphilis, antiviral or antibiotic treatments are highly effective. Partners may also need treatment. Autoimmune conditions like lichen sclerosus often require steroid creams and specialist follow-up. Pain management may include oral medications, topical anesthetic gels, or warm sitz baths for comfort. Keep the area clean, avoid harsh soaps, and wear loose cotton underwear to support healing. If cancer is diagnosed, treatment may involve surgery, radiotherapy, or chemotherapy. Early detection improves outcomes. Seek immediate medical attention if you have a new genital ulcer, severe pain, fever, or non-healing lesions. Remember, vaginal ulcers have many causes. A detailed examination is necessary, and early treatment improves outcomes. Persistent or recurrent lesions should never be ignored, and a biopsy is often necessary for suspicious cases. If you found this video helpful, please like, subscribe, and share this information with family and friends. If you have questions regarding women's health, please leave them in the comments or schedule a consultation. Thanks for watching. I am Dr. Dan Elianiku, gynecologist. Stay healthy, stay informed, and I look forward to seeing you in the next video.